Dr. Azizzadeh, thank you so much for doing the interview with us at Rhinoplasty Network. I wanted to ask you a few questions, and one of the things I wanted to start with was, you know, as you've been in practice for a few years now, and you've done hundreds of rhinoplasties, has it gotten a little bit easier to do them? Are they still hard? I mean, we know it's one of the hardest procedures to do. What are your thoughts on that as far as the difficulty and if they've gotten easier or not?
Well, since every nose is different, I think with experience, you become more of an expert, and that's something that's lost. You know, today we have a lot of individuals who come out of practice and training, and you know, all of a sudden they're rhinoplasty experts or facelift experts, etc. So with experience, you do become a better surgeon. Now, does the operation actually become an easier operation? I would say no, because the operation is still challenging and it's still very difficult, and you need to have 100% focus on the operation, and you need to pay 100% attention on the operation to be able to get an amazing outcome. So the operation doesn't become easier, but the results, certainly as you gain more and more experience with rhinoplasty, do become better and better.
Okay. If you're in the operating in the OR room and you're doing the surgery, and you're not completely happy with it, would you spend more time just, you know, going over it and looking at it and just kind of being kind of like a perfectionist? If it goes an extra couple hours, you'll go through that just to make sure everything is right before you close the nose back up?
Well, in order to get the best possible rhinoplasty outcome, you have to be a perfectionist. Because what my theory is, you have to do your revision in the operating room.
I see.
So after you're finished with everything, you put the sutures in, everything's closed, you got to reevaluate. And you have to reevaluate over and over again to make sure every little imperfection is corrected. Otherwise, those imperfections, if they're present in the operating room, in a year or 2 years, they're going to be really, really present. So that's why my operating room staff goes a little crazy, because I open the nose so many times over and over again to be able to get the best possible outcome. So you have to do that. You have to be very anal retentive.
Right, when it comes to that. That makes a lot of sense. So you do go back into the nose if you have to?
Oh, absolutely.
Okay.
And the nice thing about, I think, you know, the techniques that we're using now, we can see pretty much most of the changes right on the table. Now, we know that the swelling process changes the nose a week, 2 weeks after the surgery. But at the time of the surgery, you can tell how the nose is going to look. If you're providing the foundation, the structural foundation for the nose, the nose isn't going to change a whole lot after surgery.
Okay. Now,